My name is Raya Patel, and today I will be discussing accent bias and its correlation to global health. So here are a few things about me. I am a rising junior at Ridgepoint High School, which is in Texas. I am currently the president of my school's Red Cross chapter, as well as the International Humanitarian Law Chair for the Youth Service Council of the Texas Gulf Coast region. I am the president of my school's HOSA chapter, the chapter founder of RPHS Habitat for Humanity, the president of our school's Hindu Student Association, and in the future, I hope to join the field of medicine and research, as well as aiding in creating a more equitable world. So to begin, what is accent bias? Accent bias is a discrimination or prejudice against a group of people who have a foreign or relatively uncommon accent when speaking a language. According to the Journal of Neurolinguistics, 50% or more of the world is considered to be at a minimum bilingual, with some speaking 3 or more languages. Considering the large percent of individuals who speak multiple languages, accent bias is an inherently large problem, with those who speak multiple languages potentially being discriminated against. This problem is extremely pertinent in healthcare, since communication is a large part of the field. Accent bias in global health can look like a healthcare worker not getting hired due to an accent, or a patient not being able to get the care needed due to an accent barrier. Additionally, there are many implications of accent bias. Starting off with the deprivation of education. Education is extremely important to receive, as it is a foundation for not only thousands of different healthcare careers, but also for the health of oneself. According to UMass Global, higher levels of education led to lower levels of mortality and long-term disease. With that said, accent bias has led to the deprivation of education. According to Lewis and Clark Law School, accent bias leads to rejection of acceptance to charter schools, higher level classes, and even classroom participation. Another implication of accent bias is discrimination in hiring. Accents can prevent those who work in healthcare from bettering their work, creating medical breakthroughs, or even practicing, as they have a lower chance of being hired. According to Dr. Jessica Spence from the University of Queensland, those who spoke with a not commonly seen accent for their region were subject to more discrimination during the hiring process. This disparity in global health can lead to less healthcare workers having the ability to aid the world and create equitable care. Lastly, accent bias creates a hindrance in healthcare. According to members of the Department of Psychology at the University of Alberta, foreign accented doctors were perceived as less competent in comparison to the standard accented doctors. This comparison goes to show that accented individuals are wrongfully undervalued in healthcare, which can lead to a loss in global healthcare from a research credibility or a patient care provider standpoint. To test the results of accent bias on a local level, I issued a survey to my community, which according to Data USA is over 50% Hispanic, African American, Asian, Indigenous, and mixed race, and has a 10.2% foreign-born population. For reference, U.S. Census data shows 13.29% of the country is foreign-born. Even with a diverse and partially accented population, the results show that 57.9% agree or strongly agree our community holds bias towards accented individuals. Unfortunately, around 83.3% of respondents felt as if accent bias is not a widely recognized problem. The survey goes on to show that 66.5% of individuals felt as if accent bias is commonly seen in workplaces, educational institutions, and social settings. Keep in mind that according to Data USA, around 10.2% of my community works in healthcare, with around 7% in education. These numbers may seem small in comparison to the globe, but these numbers represent thousands of people who feel as if despite living in a diverse area that supports the living of many unique cultures, accent bias is still an issue. Imagine an area that has a smaller foreign-born population, and what sort of disparities that may occur that can prevent global health from progressing. Continuing on, 80% felt as if accent bias affected individuals in employment, education, and social interactions, further validating how accent bias is affecting jobs and education in healthcare. Many respondents shared their testimonials on accent bias and how it's personally impacted them, with their competence tested and employment chances hurt. Now, with all that said, how can accent bias be bettered in terms of global health? As seen previously, the understanding gap created by accents can impact healthcare workers and patients. One solution is to establish a language line through companies like Language Line Solutions. A language line allows for foreign healthcare workers and patients to converse through a translator, aiding in the understanding between the two. However, a long-term solution that allows accents and individuals to truly live life free of discrimination is to raise awareness. Raising awareness for future generations can allow those who are discriminatory to be held accountable for their prejudice, and allow those with an accent to truly grow and flourish. Anyone can raise awareness for accent bias, so start today.
Thank you so much for listening to my presentation. If you wish to contact me, here is my name, my email, and my LinkedIn. Additionally, here are the credits. All images are from Canva. Again, thank you so much.